Today we are going to deal with the topic case control study. So these are the topics that we are going to discuss. Case control study is also known as retrospective study or TROHOC study. Case control studies have three distinct features. First is both the exposure and the outcome have occurred before the start of the study. Second, the study proceeds backward from effect to cause. And third, it uses a control or a comparison group. So this figure explains a case control study. Initially, we select some cases who have the disease and some controls who do not have the disease, and then we assess their past exposure. For example, if it is our intention to test the hypothesis that tobacco chewing causes oral cancer using the case control method, the investigation begins by assembling a group of oral cancer cases and a group of suitably matched controls. One then explores the past history of these two groups for the presence or absence of tobacco chewing, which is suspected to be related to the occurrence of oral cancer. If the frequency of tobacco chewing is higher in cases than in controls, an association is said to exist between tobacco chewing and oral cancer. So what are the basic steps in conducting a case control study? There are 4 steps. First is selection of cases and controls. Second is matching. Third is measurement of exposure. And fourth is analysis and interpretation. So coming to selection of cases. First you have to define a case. It involves 2 specifications, diagnostic criteria and eligibility criteria. Then we have to think about the sources of cases. You can select cases from hospitals or from the general population. So what is this diagnostic criteria? Diagnostic criteria are a set of signs, symptoms and tests used to determine the diagnosis of a person. The diagnostic criteria and the stage of disease, if any, to be included in the study must be specified before the study is undertaken. While investigating cancer, cases should be histologically same. The diagnostic criteria should not be altered till the study is over. Next is eligibility criteria. Only newly diagnosed cases, that is incident cases within a specified period of time, are eligible than old cases or the prevalent cases. Next is selection of controls. The controls must be free from the disease under study. They must be as similar to the cases as possible except for the absence of the disease under study. So what are the sources of controls? They can be hospital controls, they can be relatives, they can be neighborhood controls, or they can be from the general population. Next is second step in case control study, that is matching. An important consideration in case control study is to ensure comparability between the cases and controls. This involves what is known as matching. There is something called as confounding. Confounding is a situation in which a measure of association or relationship between exposure and outcome is distorted by the presence of another variable. Confounding factor or confounder is defined as one which is associated both with exposure and disease and is distributed unequally in the study and the control groups. The presence of a confounder can lead to inaccurate results. A confounder meets 3 conditions. It is a risk factor for the disease independent of the risk factor. It is associated with the risk factor and it is not in the causal pathway between the exposure and the disease. So, when we are considering the alcohol use and lung cancer, smoking, which is a confounding factor, may affect the result of our study. Coming back to matching, it is defined as the process by which we select controls in such a way that they are similar to cases with regard to certain pertinent selected variables which are known to influence the outcome of the disease. If not adequately matched, could confound the results. There are 2 types of matching. One is group matching, which is also known as frequency matching. Second is pair matching, which is also known as individual matching. The disadvantage of matching is the tendency for overmatching, that is, matching on numerous variables. The matching variable is eliminated from consideration and therefore it cannot be investigated for etiological association with the disease. The third step is measurement of exposure. Information about exposure of both cases and controls may be obtained by interviews, questionnaires, studying the past records of cases such as hospital records or employment records, and through clinical or laboratory examination. An investigator should not know whether a subject is in the case group or in the control group, and this is known as blinding. The fourth step in case control study is analysis and interpretation. Exposure rates among cases and controls to suspected factor, and second is estimation of diseases associated with the exposure, which is also called as odds ratio. Example of a case control study of tobacco chewing and oral cancer is shown in this table. Here A represents cases, that is those with oral cancer, and they are tobacco chewers. B is controls, that is those without oral cancer but they have the habit of tobacco chewing. C is those with oral cancer but they are not tobacco chewers, and D is they are those without oral cancer and they do not have the habit of tobacco chewing. So for calculating the exposure rate, in exposure rate we are trying to find out the exposure rate among cases as well as the exposure rate among controls. So to find out the exposure rate among cases, the formula is A divided by A plus C, and in this example it is A is 33 and divided by A plus C is 33 plus 2, 35. So the answer is 94.2% is the exposure rate among cases. And for controls it is B by B plus D, and we get a value of 67%. So among controls the exposure to tobacco is 67%. Next is estimation of risk. Disease risk is measured by relative risk or risk ratio. Relative risk is incidence among exposed divided by incidence among non-exposed. But relative risk can be exactly determined only from a cohort study, because there is no appropriate denominator or population at risk in a case control study. Next is odds ratio, also known as cross product ratio. It is the measure of strength of association between risk factor and outcome, and it is based on three assumptions. The disease being investigated must be relatively rare, the cases must be representative of those with the disease, and the controls must be representative of those without the disease. For calculating the odds ratio, again we need this table, and here the formula is AD by BC. If the odds ratio is estimated at 8.1, it implies that the risk of oral cancer was 8.1 times greater in individuals who chewed tobacco than in those who did not chew tobacco. Next, coming to the various types of bias in case control studies. Bias is any systematic error in the determination of the association between exposure and disease. Basically, there are three types of bias in case control study: selection bias, information bias, and confounding bias. Selection bias can be of two types: prevalence incidence bias or admission rate or Bergsonian bias. And an information bias can be of three types: memory or recall bias, telescopic bias, and interviewer's bias. Coming to the advantages of case control studies, it is relatively easy to carry out, it is rapid and inexpensive, it requires comparatively few subjects, particularly suitable to investigate rare diseases or diseases about which little is known, no risk to subjects, it allows the study of several different etiological factors, risk factors can be identified, there is no attrition problems because case control studies do not require follow-up of individuals into the future, and ethical problems are minimal. Now, what are the disadvantages of case control studies? Problems of bias, since it relies on memory or past records, the accuracy of which may be uncertain. Selection of an appropriate control group may be difficult, and it cannot measure the incidence, can only estimate the relative risk. It do not distinguish between causes and associated factors. It is not possible to determine whether the attributed led to the disease or vice versa, and it is not suited for evaluation of therapy or prophylaxis of the disease. So these are the references. Thank you.